I'm Ashley Adrienne Rohde. I go by my middle name, Adrienne, and I am a nurse practitioner here at Edmonds Family Medicine, Virginia Mason. My specialty is family practice, and I chose this because I fell in love with nursing when I was first a nurse starting in 2006, and I loved working in a hospital and seeing my patients, but I really miss the continuity of care, and also I really love preventative care, and so I realized that I loved being a nurse, but I wanted to be able to follow patients long term. I treat a variety of conditions. I love working with patients on preventative care, contraception, and then I also really enjoy managing chronic conditions like diabetes and high blood pressure. I also work in our walk-in clinic, and this is where we treat a lot of urgent conditions. I really enjoy doing procedures like suturing up wounds and things like that also. Yes, I feel like this is a really hopeful time. I'm so excited about the changes that we've seen, just even since I've become a nurse practitioner, and how medicine has changed and how our technology has changed. And I think that's one of the most fun things about this job is that you learn something, but you get to keep learning and keep growing. My favorite part of my day is my patients and the team that we work with here. I love my coworkers. I think they're fantastic. And I also joke all the time that we happen to have the best patients because they're just a joy to work with. It is so fun to partner with people and be able to feel like you're providing a service, being helpful to them and helping them to get the care that they need. One of the best feelings in this job and one of the best days is being able to tell someone that they don't have diabetes anymore, or that we get to decrease one of their blood pressure medications. And it's just so fun because we're working together to accomplish the same goal. I am inspired by my patients a lot. I love that this job has allowed me the opportunity to get to have these deep, meaningful relationships with so many people that I wouldn't normally meet. And I get to learn from them and grow with them and see how they change over time. I feel really strongly about having shared decision making with a patient, and what this means is that we're making the decision together. I want to work really hard to take out the hierarchy in medicine and have it be a team approach, me working alongside my patient so that we can be really clear on what our mutual goal is. Because not everyone's goal in medicine is going to be the same. Optimal wellness for one person is going to be really different from another person, and we need to weigh out and make decisions together based on what treatments you're willing to do, what you're not willing to do, and what your goals are. I try really hard to make sure that I listen to patients and to engage them in being an active member in their health decisions that we make together. And so I really hope that I help them feel unique, heard, and that their healthcare plan is really tailored to their individual health and needs. I think a team approach is really important because there's so many of us and we each have a different skill set. I love that I get to be in family practice, and as a primary healthcare provider, I get to help be a manager of that. But I love that at Virginia Mason, we have such easy access to so many different specialists that I can consult with and we can talk back and forth. I really appreciate that the communication has been so wonderful with the specialists and that we're really bringing in all the people that we need to help make the best decisions. So the reason why I've chosen to stay here at Virginia Mason is because I love that there is a goal of keeping the patient the center and trying to focus on that. And I love the team approach to medicine. I love that I'm working alongside specialists and physicians and pharmacists, and that we all collaborate and work together. I think building a relationship with a patient is something that naturally happens over time. And it takes time to gain someone's trust. And I understand that. And that I know that it feels really scary to come in and meet a stranger and be vulnerable about a health concern that you may be having. But I try to be open and present, and I try to pick up on someone's fears and concerns. And I think over time, demonstrating that I'm going to be there and be present builds trust. So when I'm not at work, I love to spend time with my family. I'm married and I've got two awesome kids that I adore. I also adore my husband, I guess I should say that. But they're really fun, and we like to do a lot of outside adventuring as a family. So we like to mountain bike and hike, and just spend time together, mostly outside if we can.